Hello again, Dr. Lalezari again. I'm Dr. Lalezari, general and bariatric surgeon based out of Los Angeles, California. Here to talk to you about what to do after surgery, your post-operative care. Now, again, these are general tips for what you should do after surgery. Now, discuss it with your surgeon, see what they do. Most of my methods involve what we call enhanced recovery pathways. Enhanced recovery pathways are key steps to take by the surgeon and staff. It involves things before surgery, during surgery, and after surgery to help speed up your recovery so that you're not out of commission for about a couple weeks, and hopefully it'll only be a few days that you're in pain. Most people after surgery will have pain. You may not experience much pain on the day of surgery. Most people start to experience some pain the following day. It may get a little worse the day after, but then it should start getting better. Now, there's certain medications that you can take. You will be prescribed, for the most part, a narcotic medication or some sort of pain medicine, depending on what type of surgery you've had. Now, most of these medications have Tylenol in them, acetaminophen. Now, you can only safely take about 3 grams of acetaminophen in any 24-hour period. So you want to make sure that you know what medications you're taking and if they contain acetaminophen. Anything over about 4 grams a day can cause liver problems. So you want to make sure that you know what you're taking prior to adding other over-the-counter medications to whatever your surgeon has prescribed for you. Okay, so again, it's very important to discuss these things with your surgeon. Now, there's other anti-inflammatory pain relievers on the market, things like ibuprofen, things like Aleve, and naproxen. Now, these are okay to take in conjunction with acetaminophen. So now, usually what I tell my patients is take the narcotic-based medications if you need them, because the most important thing is to manage your pain right after surgery. Now, 1 week out from surgery, you don't want to be taking the narcotics anymore. You want to slowly try to transition yourself to over-the-counter medications, that being acetaminophen and ibuprofen, or something of that category. It's called an NSAID, a non-steroidal anti-inflammatory drug. So now you can safely take about 1 gram of Tylenol every about 8 hours. And ibuprofen is about every 6 hours. Now, if you want to try to start transitioning yourself off of narcotic medications and get yourself purely on over-the-counter medications, which are safer and less addictive, what you can do is try to start incorporating these non-steroidal anti-inflammatory medications into your pain regimen after surgery. Now, you can split them up. You can take the narcotic pain medications as you need them, and then take Tylenol or acetaminophen and ibuprofen staggered every 4 hours. Okay? But again, it's very important that you keep in mind how much acetaminophen you are taking in the day. And then eventually wean yourself off of the narcotics so that during the day you're taking at, let's say, 8 a.m. you take acetaminophen, at noon you take ibuprofen, at 4 p.m. you take acetaminophen, at 8 p.m. you take ibuprofen. And again, you could play with these medications. They're all over the counter. Take them as directed, okay? Again, it's very important. Read the labels, talk to the pharmacist, talk to your surgeon. Make sure you have a plan for how you're gonna manage your pain, okay? So that's how to manage your pain after surgery. Now, icing the surgical site. It's a good idea to put some ice on the surgical site. And you could do this about 15 minutes on, 15 minutes off to avoid freeze burn to your skin. Okay, and that sometimes helps with pain too. Some people recommend putting heat over the surgical site as well, as it increases blood flow and helps with the pain. However you're comfortable, either should be okay. You could put ice, you could put heat. My personal preference is to ice the surgical site. Now, I do a lot of abdominal surgery. For the most part, all of my patients go home with an abdominal binder. Now, this helps bolster your abdominal wall and helps decrease pain. So my recommendation to wear an abdominal binder. Now, when you're up and about is the most important time to wear the abdominal binder. You don't need to always have it on. When you're laying in bed, you don't need to wear it. But when you're up and about, wear it, especially for about the first month. Now, if it's really uncomfortable, it bothers you, again, not really necessary. But if you're doing anything strenuous, it's a good idea. It'll help control your pain. Other things to look out for after surgery is resumption of physical activity. Now, this is a very common question. When can I get back to my daily routine? Now, an important thing to keep in mind when we're discussing this is your body takes about 6 weeks to heal anything. Any body takes 6 weeks to heal a wound up to 80% of its max strength. Okay, and that occurs in the first 6 weeks after surgery. Now, when you have incisions, especially some the larger incisions where you pull specimens out of, or anything above 12 millimeters should be closed with a stitch. And again, like, this is going to be healing over the next 6 weeks, so you want to try not to stress out that area if you can avoid it. Now, walking's okay, light physical activity is okay. Heavy lifting is a no-no, okay? Don't want to do any heavy lifting. Now, what's heavy? Anything above 20 pounds. In like the first couple weeks, maybe stick to less than 10 pounds. Then after the first 2 weeks, you could increase it to 20. After the first month, increase it a little bit more than that. But still try to restrict your heavy lifting for the first 6 weeks. Definitely for the first month is best. And again, it depends on what kind of surgery you had, so you can discuss this with your surgeon as well. But for the most part, if you have an incision that's over 12 millimeters, you want to avoid the heavy lifting for at least the first month. And you want to avoid anything that puts too much stress on your abdominal wall. So things like sit-ups, you should also try to avoid. Now, there's no good data out there to say you should really avoid sit-ups, but the way the body heals, it's a good idea to try to avoid it if you can. Wait until that first month after surgery and get back into your normal routine. Another thing is anything that you do after surgery, ease into it. You know, if you're gonna get out there and go lift weights after that first month, don't go lifting a car. You know, just keep it light, keep it easy, and ramp it up over subsequent days, okay? Because the worst thing that would happen, and the thing that you don't want to happen, is to start experiencing pain, because you gotta remember your body's still healing. Any wound takes a full year to mature. Now, it's a long time, but again, keep in mind that that first 80% of that healing process occurs in the first 6 weeks. But again, you don't want to stress your body out in the beginning too much, so take it easy, ease into it, and slowly ramp up. You got time, okay? What else is out there for your post-operative? Resumption of your medications. As long as you're resuming a normal diet, a regular diet after surgery, you can resume your medications according to your schedule. One of the other things you gotta consider is if you're on a blood thinning medication, discuss with your surgeon when to resume that medication, okay? That's also important, when you can start taking that medication again. And then most surgeries nowadays will have either glue or staples. For the most part, I always try to use skin glue because it dissolves and there's not much care involved with it. Now, that glue that's on your incisions will dissolve in time. No need to rip it off, no need to pick at it. It will dissolve in time. Sometimes it takes a few weeks, but it will go away. If it really bothers you, after you've seen your surgeon for your follow-up visit, you could use things like Neosporin and gently rub it on that glue to dissolve the glue. It has nothing to do with the antibiotic of it, but it's the base of that helps dissolve the glue. It's called petroleum jelly base. That helps dissolve the glue. You can rub that kind of twice a day and it'll help get rid of the glue faster. But again, wait until you've seen your surgeon, make sure everything's okay before you start doing things like that. Staples, you want to keep your incision covered for the first 48 hours after surgery. Then you could remove whatever dressings on it. You don't necessarily need to keep it covered after that. If it makes you more comfortable to keep it covered, you can cover it. Just make sure that the dressing that you put on it is clean and dry. Okay, and again, after the first 48 hours, for the most part, it's okay not to put any kind of dressing over it. Now, some people, if they've had emergency surgery, may come out and go home with a drain. Now, a drain is usually connected to a bulb suction. Now, if you're a patient who has a drain, it's important to drain that every day and record the output of the drain. Most of these bulb suctions will have a measuring device, not a device, but markings on the tube, on the canister itself, so that before you dump it, you just look at it to see how much was in there, just jot it down. It's good for your surgeon to know what the output is, because depending on how high or how low the output is, that's when it's determined to be safe to remove. Other things to keep in mind: when to shower after surgery. If you have skin glue, you could shower right after surgery. That's okay. You want to avoid bathtubs, jacuzzis, saunas, pools. You want to avoid submerging your incision in water for about the first month, I'd say. Especially avoid hot tubs for the first month. Now, you can discuss when it's okay to submerge your incision when you see your surgeon, but for the most part, I'd say until it's fully healed and fully scarred over without a scab over it, then you can submerge the incision. Up until that point, just showering's okay. Don't scrub your incisions, let water run over it. Soapy water's fine as well, but you don't want to scrub it. When you get out of the shower, pat yourself down, pat your incisions dry, keep them dry. But again, don't scrub them, okay? And if you have staples, after the first 48 hours, it's okay to shower. And again, same principle, don't scrub your incisions. It's okay to let water, soapy water run over it. And when you get out, rinse off. When you get out of the shower, just pat it dry. I think we've discussed all the most important things and all the common questions I get from patients after surgery. One other thing, when can you go back to work? Now, this idea of when you can go back to work depends on what surgery you've had. But for the most part, in about 2 weeks after your surgery, it's okay to go back to work. For some surgeries, it's even 1 week. Depends on how well your pain is controlled and whether or not you're taking narcotic pain medicine. But for the most part, most surgeries, about 2 weeks, you're okay to go back to work. Now, if your work involves any kind of heavy lifting, you'll need to be on restrictions for the first month after surgery. Now, again, that time will depend on your surgeon. Every surgeon has their own preference about how long they want you to be on restricted activity, and it depends on what body part you've operated on. So again, discuss it with your surgeon. But some people are back to work after a few days, and they only need to take a few days off of work. And again, most important in there is what you do for work. So discuss it, see what's appropriate for you and your work and your life. That's about it. If you have any other questions, feel free to email me. You can look me up on my website. It's lalezarisurgical.com. I'll leave a link below. Feel free to reach out to me on Instagram at drlalezari. It's Dr. Lalezari. And yeah, thank you for watching. If you like this video, please subscribe and hit like. If you have any burning questions, any other videos you'd like me to make about anything to do with surgery, feel free to leave a comment, and in a subsequent video, I will address it. Again, thanks for watching. Appreciate your time. Be safe. Have a good day. Take care.